This is the Dental Up Podcast, your daily source for insights from dentists and leaders in the industry. Brought to you by Keating Dental Lab, a full-service, award-winning dental lab that is here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.
Good morning, and welcome back to the Dental Lab Podcast. I'm Bob Brandon, your host and the general manager here at Keating Dental Lab. A happy belated Father's Day to all you dads out there listening, and I hope you had a good one. So I'm going to give a quick shout to three boys. They're all entering freshmen at Mater Dei. One's the class president, and the other two are class senators. One plays football, one soccer, and the other one baseball. For some reason, they enjoy listening to this show, and I'm pretty sure it's just to make fun of me. But just remember, boys, there's a saying, payback's a bitch, and I can play the long game and strike when you least expect it. So good luck with that. So today's guest is a Georgia Bulldog. Congrats on that national championship and beating Coach Saban. And he worked for several DSOs right after dental school, and then purchased an older practice in the early days of COVID. Fast forward to 2022, and he's taken a practice from basically zero and transformed it into a $1.4 million venture. He's here to share his story and to give us some tips on how to successfully manage a startup. Please welcome to the Dental Up Podcast from Fayetteville, Georgia, Dr. Perry Joyner. Today's guest is Dr. Perry Joyner from Fayetteville, Georgia, owner of Fayetteville Family Dental Care. Dr. Joyner, good afternoon, and thank you for joining us on the Dental Up Podcast.
Thank you so much for having me, Bob.
Well, it's been great getting to work on your cases for the past year and a half, and I just thank you so much for trusting Keating. I mean, we're all the way across the country here in California, but it's our honor and pleasure to be able to provide lab services and restorations for you and your practice.
Yeah, I've been absolutely thrilled with you guys. I when I first bought this office, I was using a local lab, and I just had a lot of headaches.
Oh, sorry.
So as soon as I kind of got the digital scanner, and it was, pretty feasible for me to, you guys have great turnaround times. Your turnaround times are actually equal to what I was giving my local lab, even though they're down the street. I've just had basically no issues with anything that I received.
Wow. Well, that's fantastic to hear. And that's not always the case. It's,
there's been things, but like instantaneously, it's been handled, even if you guys are perfect, I'm not, so there would be mistakes.
Hey, and we're not perfect, but it's all about working together. We all work for the patient, and we all want the best final result. But hey, so thank you for the kind words. I really appreciate it. But let's kind of back up a little bit. And I know you're in Georgia. You went to college for the University of Georgia, and then where'd you go to dental school?
I went to dental school in Arizona at Midwestern University. It's like a private dental school.
Oh yeah, excellent. That's just right outside of Phoenix.
Mm-hmm.
Excellent. And what year did you graduate?
2013.
Wow. Oh, that's awesome. That's so cool. And then did you move back to Georgia for your first job? What was your first job out of dental school like?
So my first job was for a corporate group, one of the big ones. And I had a pile of debt. So I told the recruiter, I want to go somewhere where I can do lots of molar root canals, lots of oral surgery, and be as busy as I want to be. I went to rural Wisconsin.
Oh, wow.
And I was just insanely busy from day one.
Well, it's good. I mean, a lot of experience and a lot of the procedures that you wanted to do. I mean, you kind of earmarked that.
And just the population ratio is so good. I mean, you're as busy as you want to be doing whatever you want to do in those areas.
Excellent. So yeah, a lot of experience with clinical procedures. And then, so you found a practice for sale near where you grew up in Fayetteville?
I was actually in the process of doing a startup on the other side of Atlanta.
Mm-hmm.
And then 3 days away from signing the lease, the coronavirus hit.
Oh, no.
So I just kind of bailed and was living on a sofa. My family was in another state. And I just started cold calling dentists because I figured there'd be some old guys that kind of just wanted to hang it up.
Sure.
And then I found out about this practice and then really didn't look at it too hard, just looked at the basic numbers and then bought it.
Wow. And it sounds like it's worked out phenomenally well for you.
Yeah, I've been pretty fortunate.
Excellent. Well, hey, it's not without hard work and planning, obviously, on your part. And, hey, you throw in a pandemic and that puts a lot of people out of business and changes a lot of situations really quick. But I'm so happy for you. I mean, it's been a great relationship.
When I walked into the office, there was actually no patient scheduled.
Oh, wow.
Yeah, there was nothing on the books. So I had a huge note, nothing on the books. But for like maybe some of your listeners that are newer, I would embolden them that like dentistry is a fairly resilient business. People still have teeth.
Yep.
So it is really not hard to kind of make it as a small business owner, as a dentist.
So tell us, how did you grow from zero to where you are now? Like, where'd you get your patients from?
Word of mouth, mainly. I don't do any marketing. I'm in network with a few insurances. We're dropping them slowly.
Yep.
And just honestly, answering the phones, you have to get the right staff in place and kind of make sure that everyone is doing what they're supposed to do. But if you cold call the practices around an area where you're looking, you'll notice that a lot of them don't answer phones.
Right.
So if you just answer the phones in a good way, and then your operations are pretty smooth, people will get in the chair, and then you just have to do good dentistry, and then they come back.
Yep. It's the personal touch. And I love your staff. I love speaking with your staff and everybody that you have answering the phones. It's a live human being every single time. You don't call and get a phone menu where you got to push 6 different buttons to get through to a live human. And we're
that's the kiss of death. I can't imagine ever doing that.
It really is. And
that's something that changed. Yeah, the office when I bought it was doing that. And then I got rid of that day one. And that helped a lot.
People want to be treated by another person. But, we're the same way here. We tell our people, guys, you got to answer on the first ring. I mean, it's got to be that way. We have a great phone staff here, and I'm thankful for them. And I know you as well. And you have them really well trained. I mean, they know your patients, they know the cases, they know, teeth numbers, restorations, and colors and everything. And you've done a great job with your team.
We're always trying.
Excellent. So tell us a little bit more in depth. I mean, so you started and you had an assistant or a front desk, and how many hygienists? How's this evolved?
When I purchased the office, it had one dental assistant. It had one and I guess 2 front office. One of them was an office manager, which was really odd because there was only one office person there besides her. And then 1.5 hygienist.
Oh, wow.
And they're all gone. That was gone almost instantly.
Yeah. So you hired just brand new staff?
Yep. Yeah. I mean, it's kind of like old wineskins can't fit new wine.
Yeah.
And, I think we definitely had to crank it up a notch as far as how hard we were working.
Yeah.
But now I was all the way up to 4 hygienists,
wow.
3 dental assistants, 3 front office, and I had an associate for a few months. And then now I have an in-house periodontist as well who joined us, who's just wonderful.
Excellent. And then placing your own implants, or is that?
I am. I placed them for years before I came down here, and the office did not have the equipment initially, but we have the cone beam and the iTero. We're doing the surgical guides and the implant placement of the time.
Oh, that's awesome. Wow. That's fantastic. You've really taken off. And so one of your first purchases was the iTero. Which version did you get?
Well, I can't. I think the one that has the NIRI where you can see inside the tooth and stuff.
Oh yeah. The caries detection.
I would honestly say I think an intraoral scanner is great. I would honestly look heavily at the Medit if I could go back in time, but scanning in general, I think is a great idea.
Oh, absolutely. The digital technology has really revamped the way we do business, the way you as clinicians do business, and on the lab side. It's really the future, and there's no going back because all these companies are investing heavily in R&D and coming up with new applications for it. They're coming up with new materials for us to utilize. You shared with me a removable case. Tell us about that case and how you scanned it and everything. And then what was the delivery like?
Yeah, so it was my first one of these. And I honestly was very skeptical. I just didn't understand how it made sense. But it was my first kind of digital denture with Keating on just a fantastic older gentleman who I had to bury some implants because he had some medical issues. So we moved him to a complete denture. And him and his wife were just thrilled this morning. It was probably the easiest denture delivery I've ever done, and I've been at this for over a decade.
Oh, that's so cool.
It was super tight. The retention was unreal.
Good.
I just found it to be very smooth. They were both very happy. I don't typically like dentures, so I actually told my rep at Keating, I was like, I'm going to try you guys for a denture because I've kind of given up on lots of other labs in regards to this, and it just went really, really smooth.
Dentures are hard. Removables are hard, in general, but dentures especially, and yeah, it can be a frustrating process for the clinician, the patient, and everything. But so on the digital workflow, did you use the centric tray, or did we get you one of those, or did you just do a conventional CR bite with occlusal rims?
I just did the CR bite with the occlusal rims.
Okay. And how many steps total did this take?
I think 3.
Yeah, that's beautiful.
And a lot of that can be assistant driven, which is why I said I think, because I'm not doing most of it.
Oh, that's good.
I just basically did the delivery today, and whatever else I have to do legally in the state of Georgia. But
Yeah.
yeah.
Oh, that's awesome. No, that's great that you have well-trained staff like that can, take on this burden. I mean, the denture and, obviously you did the bite. The bite's the most important thing. The CR, we get so many cases where we have to reset the teeth because the registration is not correct. But obviously you did it right, because I know, as we were speaking from before, we didn't have to do a reset. We went from trying straight to finish. So that means your bite registration was correct.
Yeah. I mean, it was great. I was really pretty stoked on that. I was not looking forward to delivering a denture on a Friday, and it went great.
Excellent. How was the color, the finish?
It was all great, man. It really was just a really well made denture. I mean, the wife was tearing up and all that stuff.
Oh, that's
and he
nice.
was just thrilled. The thing that had me thrilled is that the retention was just really, really, really good. And that's where I was skeptical at first, with the whole digital workflow. Like, how can that possibly work? But it did. It worked really, really well. I actually loosened up the retention a little bit because the retention was so good.
Too tight. Okay. Yeah, that's one thing where the companies, the scanning technology and the software has gotten a lot better. At first, when these things first came out, the soft tissue, it was not really well captured. We would have tons of data voids, tons of distortion, everything like that. But the camera and the focus and the software has gotten a lot better. The early scanners, they were great with hard tissue, but really, really poorly incorporated with their soft tissue workflows. But, now with, more R&D, I'd say most of the companies have really improved their game and their specificity on soft tissue and soft tissue landmarks and everything for us, so we can make an accurately fitting prosthesis.
Right.
So tell us about some of your your crown and bridge cases and your workflow, and how you're prepping, and how you isolate margins, and then guess what types of materials you're using through Keating, and then your delivery process.
Okay. The workflow for me, I'm usually prepping with a 014 or 016 chamfer burr.
Beautiful.
The cool thing is it really only about 10 minutes of the procedure are me, maybe 5 to 7 minutes to prep and do the buildup if needed. And then 2 to 3 minutes. I still like the 2-core technique. I've tried all the other techniques out there, and I just still like it the best.
That's one of the pearls for our younger listeners to pick up on. Margin isolation is key. And I was speaking with Dean right before I came in to the office for this meeting. And I said, Dean, he's our CAD/CAM manager, and he looks at all the scans. And, I said, let's pull up some of Dr. Joyner's scans. And we were absolutely blown away. Everything is perfect and pristine. And, the margin identification for us is easily the most challenging step in this process. But thank you. You make it easy for us. I really appreciate that.
Well, my margins aren't pristine, but the 2-core technique makes them very visible to you guys.
Yeah.
And I think if you guys really like having the depth differential, right?
Oh yeah.
From the second cord.
100%. Yeah.
So I'm trying to get my team trained to where I don't have to do that step, but I think having loops helps.
Oh yeah.
I would say that the 2-cord, every time I skip that and I try to do some other technique, I usually wish that I had not. So I would say that's really worth it.
Yeah, it takes another 2 minutes, but it saves you sometimes 20 minutes in time on the back end.
It does. Usually my assistants temporize. If it's a difficult or like a big anterior case, I would usually do it. I mean, I'm running typically 7 to 8 chairs. So 3 to 4 columns of hygiene and 3 to 4 columns of operative. So I don't have too much time to, a lot of this is delegated. But I think if the prep is semi-smooth, it's pretty, if you try your very best to prep, no, I don't have golden hands at all. And then you have a very good depth differential in the cord. I have not had any issues with any of the Keating's crowns.
Yeah. Well,
Material wise, I love the Bruxer and the Bruxer aesthetic. The Bruxer aesthetic to me is honestly, I think it's comparable to the Emax almost at this point.
I do too. Actually, I do too. It's a beautiful material and nearly double the strength of Emax. So it's fantastic.
I like the way it makes cementation easy. I find it to be very low stress.
Right.
Yeah, and then my assistants typically scan. If it's a difficult scan, I'll go in and scan. I do think it's important to audit the staff every now and then on that. It's just natural that they'll kind of want to let things slip through the cracks because it can be difficult to get an appropriate scan in the patient's mouth. So every now and then I have to hop in.
Yeah, well, you've got them trained really well, and you're doing the smart thing. I mean, you are working smarter and not harder by delegating some of these procedures, and you've got the staff really well trained, and it allows you to be more efficient. I mean, 7 to 8 chairs, that's a lot for a solo practitioner. That's a lot of work.
Yeah, it is. But again, it's like I'm in 10-minute increments. I'm 10 minutes here, I'm checking 2 or 3 hygienists, then 10 minutes there. I think it's very doable.
Wow. Well, that's fantastic. I mean, and that's a lot of patients then. I mean, that's if you're busy, 5 days a week on that kind of schedule, that's an awful lot of patients. So was it all just word of mouth when you started the operation, or?
I think, Google reviews, we went from about 60 to we have right at, I think we're at 598 right now.
Wow. That's awesome.
You kind of want to have Google reviews. I feel like the critical mass is right around the 200 mark is the first one. And then the 500 is another big milestone. So if you can get above, and they won't all be positive, you'll have 2 or 3 1-star stars, but you want to have mainly positive and over 500 Google reviews. I think that's a big key. But honestly, the marketing doesn't mean anything if you don't have good people at the front that answer the phone and convert that to a patient.
Oh, I agree. Yeah, 100%. I mean, the first impression means everything. And, having a well-trained, front desk staff that's, friendly, personable, welcoming, and treats the patient with respect and kindness, that goes a long way into the overall success of your practice.
I would say shadow call your staff every now and then. I do.
I love it.
I shadow call my I'm on a few mastermind groups, and a colleague who I feel like his front office is killing him, and he just doesn't realize it because he's just pouring all this money into marketing. And every time I call and I try to get in, the staff, I can't. They just kind of find a million reasons to not let me end up on a schedule when I'm pretending to be a cash patient who's willing to pay thousands of dollars for implants that day.
Wow.
So, I think there's a lot of, I really think arguably the most important part of the dental office is the lady answering the phone. They're the gatekeepers, and nothing else matters if they don't, first of all, actually pick up the phone. Like in my office, we have a 2-ring rule. If it gets more than 2 rings and somebody's around and they don't answer it, they need to answer it.
Absolutely. We're the same here. And I love it when Sean walks around and, the phone's ringing and he shoots that glare at you. It's like, God, you got to pick up the phone, guys. Come on, let's go.
That's somebody knocking on your door saying, I want to help your business grow.
Definitely.
You just have to answer it, and you have to treat them accordingly. I tell my team all the time, it's like, I'm not the boss. The boss is the patients. As long as they keep walking through the door, life will be grand. And if they ever stop, it won't. So we work for them.
Those are words to live by. I love it.
I think that the patients realize that and they kind of feel it in the office, and it's really kind of contributed to the explosive growth. I really believe that.
Yeah. You're absolutely right. We all work for the patient. And if the patients don't show up, we don't have jobs. And that's another pearl for all you young dentists out there. So tell us a little, what's it been like working with Keating Dental Lab?
It's been great. I initially, when I bought the office, I did local, and then I tried out a bunch of different labs. I tried out a really cheap discount lab that I won't mention.
No names. Yeah.
No names, I know. And I tried a few other, and the biggest, I'd say there are 3 big differences I've noticed. One is that with the discount lab, but this is what you'll find that there'll be they'll give you the A team, and you'll get some good work. And after about a month, it will go down the crapper.
Yep.
Okay.
That's called the bait and switch.
Yeah, and I knew it was happening. I was like, hey, put me back on the A team.
Yeah.
And the second thing is the complex cases. You have to use a good lab for complex cases. that recent full mouth rehab case I did with you guys. I couldn't have, I mean, your techs were just invaluable with that. I mean, that was 30 units or something.
Yeah. It was a big one.
It was a big deal. And you guys really, I wouldn't have felt confident taking on that case if I didn't have someone like that. And the third thing is like when you have problems, like I call Barry, man, it's like, boom, like we're on it. And he's very reasonable. I mean, he just gets stuff done.
Yeah, absolutely. Yep.
In the very beginning, when you first get a practice note, you're like, all right, man, if they make a crown for $10, that's the one I want, because you don't realize how valuable your reputation is, and also how valuable not having to send crowns back, not having problems appear down the road because of crappy materials. What's his name? Deming. Deming, that total quality control guy.
Oh yeah.
I think that makes sense for me with the way he talks about, like, you should completely focus on quality and the efficiencies kind of take care of themselves.
Oh, 1,000%. And I mean, there's two lessons in there, is the old saying, you get what you pay for. But we've always felt that, our prices are a little bit higher, but we're taking the time and effort to avoid future problems. And, we appreciate dentists like you that are also on the same, on the same level and have the same feeling about quality and have the same attention to detail that, hey, we're only going to do it once. And, the patient's going to benefit. The insertions are going to be, generally a lot less than you get from the cheaper labs. But yeah, I mean, we don't want to be doing stuff over. It's just, it's not efficient.
There's also something to be said for after a few years, when I see a really well done crown and I feel the edges on it, it makes me happy.
Yeah.
When I see some of these crowns that, from the mediocre labs I did, I've actually just redone a whole bunch of them because I don't like looking at them, so I end up redoing them for free anyway. So then in fact, I would say if you could learn the way without having to go through the experience, that'd be better than what I did.
But that's part of the learning process is, learning, and I won't even call it a mistake, but you don't really know what's out there until you get more experience and until you try a couple other labs. And there's labs in all price ranges here in the United States and overseas. And it's really one of those things. You have to find the right fit. And I'm so thankful that you searched us out and, started sending cases to us, because I feel it is the right fit. Your practice and your philosophy and your skill set meshes with ours extremely well.
Well, yeah, and you've noticed that the quantity increases.
Oh yeah.
More and more. And it's getting to where, I mean, I'm almost going to be using you guys exclusively very soon.
Oh,
so
thank
you. Yeah.
Oh, thank you for that. That's so kind. So before we wrap up, and it's Father's Day weekend, and I know you have a family. What do you got planned? What do you got planned for the weekend?
As little as humanly possible.
That's a great answer.
Yeah, I work pretty hard during the week. So on the weekend, man, I try to do this. I don't like to talk to anybody. I'm a natural introvert, and you have to be an extrovert and do this job. A lot of us dentists are like that, probably lab techs too.
Oh, yeah.
So, when I don't have to talk, I like to be around my wife and my kids and interact with as few human being as possible. Maybe watch The Boys on Amazon and some Obi-Wan on Disney and just chill.
How old are your children?
I got a 5-year-old boy, a 8-year-old daughter, and a 10-year-old daughter.
Oh boy, those are the fun years.
Oh, they're great, man.
I've got I've got a 20-year-old daughter and a 14-year-old son, and now they're still fun, yeah, but boy, you got headaches too.
I can see that. That sounds a lot more expensive.
It is. It's more expensive and a few more headaches. I don't look like my picture that's on the screen right there. That's for sure. So you've given us so much advice. There's so much that dentists can learn from this. And again, Dr. Joyner, I just want to thank you for your time and your kindness and generosity for coming on this Dental Lab podcast. And is there anything else that you'd like to add before we sign off?
Yeah, I would just say, since I know this reaches a lot of younger dentists, I would really want to embolden these guys to don't be afraid to strike out on their own. I know the lure of corporate, you get kind of sucked into it. The rewards and like the fun and everything is just a million times better Stress too is a little bit higher. But life is way better when you're in private practice. And I would really say to try to resist the siren call of that.
Yeah. You get to be your own boss, and that's a great thing.
Yeah. Good.
Awesome. Well, hey, Dr. Joyner, again, thank you so much for your time. I really appreciate all the words of wisdom and advice you gave us on your day off. And thank you for that. And anything you need from us, just give us a call. We're here for you. We're here for your family and your practice and your patients. And anything you need, man, just count on us.
Yeah, and I appreciate you guys for all you do. Thank you so much.
Awesome. Thank you.
Bye-bye.
Thank you for listening to the Dental Up Podcast, your daily source for insights from dentists and leaders in the industry. This episode is sponsored by Keating Dental Lab, here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products, and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.